Pop quiz. Can you name an artery? Odds are one of the three big arteries came to mind. The aorta. This artery delivers blood from the heart to the rest of the body. The coronary arteries. These arteries supply blood to the heart. And the carotid arteries. These arteries supply blood to the brain. What about the rest? There are more than 20 major arteries throughout the body. They too deliver oxygen-rich blood to tissues throughout the body, just like the big three we all know. Also, like those big three, these arteries are susceptible to developing plaque buildup.
Basically, when we're talking about blockages in any of the arteries in the body, we're talking about the same disease, and that's atherosclerosis, arteriosclerosis, hardening of the arteries. They're all different names, but they mean the same thing. And that is plaque and cholesterol are building up in the blood vessels. We know that this doesn't just happen in one artery in the body. If it happens in the carotids, we know it's in the coronaries or in the heart, and vice versa. We also know that it's in the arteries in the abdomen and in the legs.
When these blockages occur in an artery that is not the aorta, coronary or carotid arteries, we call it peripheral arterial disease.
Peripheral means basically anything outside of the heart or the brain. So the heart would be coronary vascular disease, the carotids would be cerebrovascular disease, peripheral vascular disease would be everything else.
When the body has atherosclerosis in the coronary or the carotid arteries, the blockages can prevent blood flow to the heart and the brain and cause a heart attack or a stroke, respectively. When these same blockages occur in the peripheral arteries, they can also prevent or delay adequate blood flow. This can cause serious damage to the underserved tissues.
And when blockages build up in the leg arteries, that can lead to trouble walking. It can also lead to gangrene or ulcers or loss of the leg. So when we talk about peripheral vascular disease, we're talking about the same disease that causes blockages in the carotids and the coronaries. It happens to all the arteries throughout the body.
Someone with coronary heart disease has a 1 in 3 chance of also having blockages in the leg arteries. About 12 to 20% of Americans older than 65 years of age have peripheral arterial disease. The good news is that preventing peripheral arterial disease can be done while you're preventing coronary artery disease.
The risk factors are high cholesterol, poor diet or a high-fat diet, genetics, and low or no exercise. Same things that contribute to disease of the heart or coronary disease. They really go hand in hand. It would be very unusual for somebody to have a blockage or disease in one of those vessels and not the other. But the best way to prevent it would be eat a healthy diet, exercise regularly, and obviously no smoking. There are a couple of elements in cigarette smoke, most commonly nicotine, that's what everybody is familiar with, that actually triggers a sequence of biochemical reactions. These biochemical reactions do a few things. Number one, they cause platelets to aggregate in the blood vessels. Platelets are the sticky cells that stop us from bleeding when we cut ourselves or injure ourselves. And basically, the cigarette smoke triggers platelets to start building up inside the artery, and that's really the first step in developing a plaque.
Secondhand smoke counts too. A recent study revealed that non-smoking women who were exposed to secondhand smoke at home or in the workplace have a 67% increased risk of peripheral artery disease when compared to women without regular exposure. So, the next time you make a heart-healthy decision, remember, it's not just your heart that's benefiting. It's also your brain and your legs and your kidneys and your lungs and, well, I won't go all day. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.